mentioned mammograms earlier, and obviously you have a lot of experience with breast cancer. What do you think of that test and the guidelines that seem to change, that you should start when you're 50, and then it was 40, and then it's moved back and forth? What are your thoughts on that?
Well, let's start with the most recent study. The Canadian study that was done was a 25-year study. The results came out in February of 2014. And they found that for women aged 40 to 59, that mammograms did not reduce breast cancer mortality, not by 0.5%, nothing. And it was just as effective as a self-breast exam. So by the time a tumor or a lump is seen in a mammogram, it's been there for 5 to 8 years. So there's mammograms. And we know that the compression, the radiation, I mean, we know it causes cancer. I mean, there's studies after study. Dr. Samuel Epstein, great voice for prevention and the truth about medicine. But he said that if a woman follows a typical 10-year protocol of getting mammograms every year, every 6 months, she's getting as much radiation as a woman who was outside of the epicenter of Hiroshima, 1 mile away. She's getting 10 rads of radiation in that accumulated amount of time. So it's dangerous stuff. And I'm not saying don't ever get a mammogram. Now with the digitals, there's a little bit less radiation. But they're so inaccurate, and there's other ways for you to find out if you're dealing with breast cancer.